today we're going to talk about tendonitis of the foot and ankle. There's mainly 4 tendons that are the ones that you see on a common basis and that you would be hurting from. The one up front here is called the anterior tibial tendon. It's the one that pulls your foot up, so it's very critical. It can hurt either at the ankle or at its insertion on the medial aspect of the midfoot. It's an uncommon thing with most people. Diabetics have more problems with this, rheumatoids have more problems with this, and occasionally the normal people. On the inside of the ankle is actually the posterior tibial tendon. It's a very common disorder. You would get swelling, you feel like your foot may be falling flat a little bit. Many people complain of this ankle pain and swelling, and it causes some soreness and inability to get up on a step. On the lateral side is the perineal tendon, and it can actually hurt in 3 different places. One right behind the ankle because it chafes behind the ankle here. We call that the fibular bone. It can hurt where the initials are, where I'm pointing here. That's where the tunnel is, and it actually goes beneath a tight tunnel area, and it can become entrapped there. Or it can hurt at the 5th metatarsal base here, and that's an insertional Peroneal Tendonitis. The 4th tendon, it's a major player, is the Achilles Tendon. It does a lot of work in the foot and ankle. So if you're tender here, you can either hurt up here to get more of a Charlie horse. You can hurt here, we call that the watershed area, where the blood supply, that's not a good area, and sometimes you rupture there. And you can also get irritated at the insertion of the Achilles tendon. Let's talk about treatment options for tendonitis of the foot and ankle. With the anterior tibial tendon, frequently we're using boots in therapy. Unusual to have to do surgery unless it ruptures, which is an uncommon phenomenon. With the posterior tibial tendon, very common to treat this non-operatively. Usually we treat it with inserts. If it's an insertional tendonitis, we can inject that occasionally. We also use a brace called an ASO brace, or ankle support orthosis, where we cinch inside for some activities. We also treat this with therapy. For perineal tendon, we frequently treat this with a brace and therapy and occasional shots. If it's tender back here, we usually don't inject that, but we can inject where it goes through the tunnel and at the insertion. So for the Achilles tendon, we actually treat this frequently with really extensive therapy and sometimes a hinged boot to pull the foot up. We call that dorsiflexion when we pull the foot up to treat this and try to stretch out the Achilles tendon, because that's the source of most of the pain, is a tight Achilles tendon. If we can get it stretched out, we can usually make it feel better.